Centers for Disease Control panel has voted against requiring a prescription to get that shot, but it did move to change guidance about which age groups should get the vaccine. The votes happened after an unexpected move earlier today about the hepatitis B vaccine. The committee postponed a vote about changing the guidance for that shot. The panel was considering pushing the shot back by 1 month. The delay means infants will still get their first dose now within 24 hours of birth. Joining us now, NBC News correspondent Ann Thompson and NBC News medical contributor Dr. John Torres. And let's start with you with the COVID vaccine. There were 4 issues today that were sort of voted on by this panel. Take us through each one.
Yes, so the most important one, I think, for everybody is that you are not going to need a prescription to get that COVID vaccine. That was a tie vote, and the chair broke that tie. The second one is that instead of being recommended for all adults, it is now, the panel says, an individual choice that they hope you will make in consultation with your medical professional, especially if you are under 65, and they say that risk-benefit assessment there really is in your favor if you are at risk for severe COVID infection. That's the big thing. Those are the 2 real headlines, Kate, out of what happened today.
So if you're someone that just wants to get the shot, but you're not necessarily high risk, you probably can now without a prescription?
Yeah, you can. And the other thing is HHS came out and said these shots are now covered, because that was the other big question was, is it going to cost you money, and will that further delay?
Dr. John, there's been a lot of confusion about this. So given what they just decided, what would be your advice for all the viewers out there?
You know, my main advice is, you're right, there's a lot of confusion between the CDC, between the FDA, between the American Academy of Pediatrics. They all have different recommendations as to who should be getting the shot. The main thing is to understand this is a shot that we know through the pandemic is life-saving, has very minimal side effects, and so you want to look at it hard and fast. You want to make sure that it's something you get if you haven't gotten before. So talk to your physician. I do believe in that individual decision-making. 65 and above, definitely. Below that, especially if you have health conditions, you want to get it. And then if you haven't had it before, you definitely want to get it as well. So again, individual decision making, talk to your physician, talk to the pharmacist, do your homework essentially. Look at the American Academy of Pediatrics, American Academy of Family Physicians, the CDC, the FDA, of course, as well, and go from there. But my recommendation would be, if you haven't had the shot, get it. If you haven't had a booster in a while, get it. And then, obviously it's something that COVID's still here, and it's still going to be here for a long time.
Dr. John, quickly, the panel voted yesterday to change guidance for the MMRV vaccine. That's the one for measles, mumps, rubella, and the virus that causes chicken pox. The concern they raised was about a small risk that kids under the age of 4 could have seizures and fever. Do doctors agree?
Doctors don't agree, because that is a very minimal risk, and it doesn't happen very often. When it does, it's a benign condition. In other words, they recover very quickly from it, and they have no issues or no complications. The concern is, right now, what they're saying is get the MMR vaccine and then get the chickenpox vaccine. That's 2 vaccines. It's difficult for children to get 1 vaccine instead of getting that one until they turn 4. So the concern is less children will be getting these vaccines, and that could cause more issues as time goes on.
And do we know if they will take up hepatitis B again or not?
We don't know, Kate, but what we do know is that yesterday when they had this discussion, there was a lot of concern that there wasn't enough science there to justify a change, and that was a concern among some of the panel members.
Okay, so we're not sure on that one. We'll table that one, but pretty big news.